So we are in our third installment of this local endemic diseases under the primary healthcare programs. So third is Schistosomiasis control program. So first, Schistosomiasis is an infection caused by a blood fluke, and it's specifically Schistosoma japonicum. And as I've mentioned earlier, this will be discussed further in communicable diseases. So, though it may be acquired through infected waters, um, especially if the waters can have snails, of which these snails are considered to be carriers and of this blood fluke. Uh, and infected and untreated individuals can also transmit the disease by discharging into the feces of these humans into the bodies of water. So environmental sanitation is very important. Okay, so systemized control program is a goal, has a goal which is to reduce the disease prevalence by 50% with the vision of eliminating disease eventually in all endemic areas. Um, Again, it's like what I mentioned in my other video lectures. If there will be updates, we are going to make another video lecture for this, or we are going to include some information in the information section of this YouTube video later. Cystosomiasis control program has the following objectives, which are one, to reduce the prevalence rate by 50% in the endemic provinces, and second, increase the coverage of mass treatment of population in endemic provinces. And the interventions to excuse me to reach these objectives are first, morbidity control by mass treatment, infection control by surveillance, where these breeding sites can be happening, surveillance of school children, since these school children are also prone to having parasitic worms, especially unsanitary um, toilet areas, can be an exposure to transmission control and advocacy and promotion. So advocacy and promotion deals with information dissemination to people who are living in those endemic areas. So the last one of this video lecture series on local endemic diseases is leprosy control program. Okay, if there are other local endemic control programs, I'll be adding them in other video lectures. So please subscribe to the channel, share it to others who you think is um, will benefit from these video lectures. So the leprosy control program. Leprosy is an infectious disease also that causes severe disfiguring sores and nerve damages on especially the extremities, and can also affect other parts of the body. It is caused by usually by a bacteria called your Mycobacterium leprae. Okay, so leprosy in the Philippines, in Tagalog, it's called ketong. Okay, so leprosy control program vision empowered primary stakeholders in leprosy and eliminated leprosy as a public health problem by 2020. So that is actually last year. So let's see if this program is also updated. Okay, mission is to ensure the provision of comprehensive, integrated quality leprosy services at all levels of healthcare, especially on those endemic places. And the goal here is to maintain and sustain the elimination status. Okay. The National Leprosy Control Program aims to ensure the availability of adequate anti-leprosy drugs or multi-drug therapy. Um, as we all know, leprosy nowadays are treated outpatient manner unless there are other comorbid case of that person, and depending on the severity. Okay, and it is treated with multi-drug approach. Second is prevent and reduce disabilities from leprosy by 35% through rehabilitation and prevention of impairments and disabilities. If you happen to see a leper, which is I think less common now, okay, you will really notice uh, the light cases or the less severe ones to the more severe ones. It's like they're eaten alive, the more severe ones. And what is uh, um, good here is leprosy is not transmitted easily. It's not fastly transmitted. Okay, it needs a direct inoculation to a broken skin to really start the transmission or for you to really be infected. It's not contagious in our terms. Okay, so improve case detection and post elimination surveillance system using the WHO protocol in selected LGUs. Well, the control problem will also be discussed more, okay, in other videos. Okay. Integration of leprosy control with other health services at the local level, active participation of persons affected by leprosy in leprosy control, and human dignity program. Human dignity program is included here because of one is of the body image effects. As I mentioned earlier, it is really disfiguring. And second, a long time ago, like decades or centuries ago, leprosy um, has a social stigma. Uh, the people around these lepers are really frightened of how they look. Okay, um, in the Philippines, there are considered to be establishments which are leprosarium, um, and it goes back to the history of the Philippines, where or in which people who are considered to be lepers need to be exiled, if I'll be using the term, or thrown to those places. Usually it's an island or enclosed establishment. um, I think one of the causes are less studies are done during that time. Then treatment needs to be confined at certain establishment, not like today, because of the studies, modern studies. It is found out that it can be treated at home. It can be treated outpatient. Okay, so and the social stigma is I think lessened. And I have seen some videos from news channels featuring this case or leprosy. Okay, I also have seen one before, maybe 5 years back or 6 years back, and um, the person is has the pathognomonic sign or the characteristic sign of leprosy, which is the lion in face. Okay, you better check that out in our videos in maybe in other channels in YouTube or images in Google. Again, I'll be discussing later in communicable disease part. Maybe I'll start uploading by um, next week for communicable disease. So watch out and subscribe. So what else? We have also a strengthening the collaboration with partners and other stakeholders in the provision of quality leprosy services for socioeconomic mobilization and advocacy activities for leprosy. So again, these programs from the start, from malaria to filariasis to somiasis to dengue and to your locally endemic disease control. Um, this is a collaborative effort between the government and other organizations, okay, to make it more successful. So the beneficiaries here are families and communities living in hyper-endemic areas and those with history of previous cases because previous cases can still have recurrence of the said disease if ever it was at 100% eliminated or treated. Okay, so these are the programs under locally endemic disease control program. For dengue, I'll be uploading another videos for this one. Um, to end this video lecture, let me share to you what I found in the internet. Okay, so winners and losers. So which or where do you belong? Are you a winner or a loser? Winners say it may be difficult but is possible. For losers, say it may be possible but it's too difficult. For winners, see the gain. Losers see the pain. Winners see possibilities and losers see problems. And this one, I like this last comparison. Losers let it happen, but winners make it happen. So, God bless. Thank you so much. And do not forget to subscribe. Thank you.